Hi, good morning, everyone. My name is Michelle, and I'm here today with Dr. Val Mueller. We're both members of the Well Earth Collaborative. And today, Dr. Mueller is actually going to share with us a little bit about herself and her journey into practicing lifestyle medicine. From what I understand is that your initial education was in obstetrics, and you most recently sort of transitioned into this different area. And I feel like lifestyle medicine, even for myself, I don't know exactly what it's all about. And it's probably a term that a lot of people are not quite familiar with. So over to you, Val, and you have the floor.
Sure. Thanks, Michelle. The term lifestyle medicine is not very familiar to people in Canada. It's much more common in the States and elsewhere in the world, but it is a movement that's growing for sure in Canada. And I'll just briefly sort of say what it is, and then I'll talk about how I ended up coming into it. Really, to me, I call it common sense medicine. It really is thinking about the different pillars of health. So, diet, activity, mental well being, sleep, substance use, and thinking about those pillars and using them as a way to prevent, treat, and reverse complex chronic disease. And so, yeah, basically, if you eat well and you move and you sleep well and you take care of your mental health, you can feel better overall. Basic common sense. My journey into it was is interesting, I think. You're right that I started out as an obstetrician gynecologist and a maternal fetal medicine specialist, so doing mostly high risk obstetrics for a number of years. And then about 4 years ago, just over 4 years ago, I woke up one morning. It was May 1st. I woke up. I was supposed to be doing a 24-hour call shift that day. And I woke up feeling like I had the flu. Like I was just so tired and just achy from head to foot. And I remember thinking like, oh my gosh, like how am I going to get through 24-hour call shift? Like what's going to happen next? Am I going to start coughing? Or am I going to get a fever? Am I going to start vomiting? Like what's going to happen in this 24
Mhm.
hours? But nothing else happened. Like I got through the call shift, but that fatigue and those aches, those muscle aches, just never went away. They've never gone away. And over the few months after that first day, things just progressively got worse. And at that time, it really affected my hands. Then as a obstetrician gynecologist, like doing surgery and delivering babies, it became a patient safety concern actually, because my hands would get so sore and stiff while I was operating or doing anything with my hands that I would have to stop and take a break and rub them a bit and then I could carry on. And I was always worried that, well, what if that happened at a bad time, right? When someone was bleeding or you were delivering a baby. So eventually I had to stop that practice because for patient safety reasons initially. And then really I was having trouble getting through a workday because I was so tired and having so much pain. So I stopped working like altogether, really. Um, and I was not in a great place. Like I could barely brush my teeth. I couldn't brush my hair. I couldn't wash the dishes. I couldn't do laundry. I really couldn't do very much. Even sort of everyday take care of yourself tasks were difficult at that time. But I got really lucky being off work. You have time that you otherwise wouldn't have. And I started reading and I was sort of, oddly enough, active on social media, like just reading different things.
Mhm.
And I started to get connections, like friends of friends, were commenting on certain things, and I ended up through different connections meeting some really cool people. Um, People that, had knowledge around movement, who had knowledge around diets and helping people who had sort of chronic illness issues, whether they were pain, whether they were inflammatory in nature, whatever. And through this different combination of people I met, I started learning a lot around, changes you can make to your diet in terms of decreasing inflammation in your body. I met an excellent sort of movement person that was able to figure out how to get this very sore body moving again. Um, and I started getting better, right, by doing these things. And I would say, sort of over a 6-month period from when I was really in my worst, I started getting back to a place where, not back to my life as it was before, but back to a place where I was what I call functional, right? Like I could
Mhm.
blow dry my hair and I could, wash some dishes, and I was starting to move. I could walk the dog a little bit. And it got me to a place where I could get back to some administrative work because I had some educational roles at the
Mhm.
university as well. So I could do those. Um, and in that sort of journey, I started thinking, okay, well, like here's some strategies that can help a lot of people. I saw a lot of different consultants during that time, the usual things that people see when they're having aches and pains and fatigue, rheumatology, neurology, you name it, lots of different people. Um, but if you want to see specialists in the areas of fibromyalgia, chronic fatigue, right, it's usually a 2+ year wait list. And so while I was getting better doing these changes, I started thinking, hey, like these things are probably helpful to other people with these types of conditions. Like there must be some way of practicing medicine in a new way that isn't so physically demanding as my previous work, but that could be really helpful and share these cool things I was learning. And somehow, I can't even remember how, I stumbled upon the American College of Lifestyle Medicine, and found out that lifestyle medicine is really what I was doing, right? I was doing all these
Right.
lifestyle modifications that were making me feel better. And so that was my sort of journey to lifestyle medicine. And once I figured out that there was something that, incorporated all these changes that I was doing, and that you could train in it and then begin practicing it to help other people, that's what I did. So I retrained, did all the coursework that's
Mhm.
required,
Mhm.
did the exam, did all of that. Did a change, it's called a change of scope with the college in Ontario to be able to change my practice over. And that's how I transitioned over to lifestyle medicine. It's
Such an
how I got
interest.
better and how I
Right.
transitioned over my practice and went in a different career path. Sorry, I cut
So
you off.
just a question for you. I mean, being a physician, obviously, educated and all that, like, did you know what was really happening to you when you first had all these symptoms of fatigue and pain? Because I know for, the stories that, and I'm sure you hear this as well for patients, it's really hard to understand what is happening. And a lot of patients are sort of moving around to different specialties, but they don't know. They really don't know in the term, fibromyalgia or chronic fatigue. Um, there's more information on it and it's more and more accepted, but I still feel like there's quite a bit of lack of knowledge and awareness about these conditions still. So just wondering what that was like for you, as you were sort of going around to your specialist. Like, was it through a specialist you sort of was finally able to get a diagnosis, or was it just sort of through your own research and education and learning?
Yeah, the diagnosis, I think I came to on my own.
Yeah,
So I saw a lot of people who said it's not this, it's not that, it's not that. And when I would say, "Do you think it's fibromyalgia?" They'd say, "Oh, I don't deal with that."
right,
At the best of times, that's what they say, right? There's
right.
still, you're quite right that there is still some lack of knowledge out there, and there still is stigma out there, and
Yeah.
even stigma within the healthcare field. Like I remember, I also sort of after that, I took a course in coaching, like coaching health professionals, unrelated to complex chronic disease, but
Mhm.
just how do you support your colleagues and that type of thing. And I remember I was in a little one-on-one session with somebody, and we were just supposed to get to know each other. And I had shared that I have fibromyalgia and chronic fatigue syndrome. And it's another physician from the States. And he said to me,
Mhm.
"Well, how do you feel having this diagnosis that no one really believes exists?"
Mhm.
And
Mhm.
I thought, whoa, whoa, yeah. So even within the health professions, there's still, yes, that type of attitude that is hard. It's hard. It was hard for me as a physician to navigate, and for patients to navigate. I can't imagine how much more difficult that is.
Yeah, exactly. As you say, as a physician, hearing this from another physician, it's like, oh, okay, great. Where do I go from here? Knowing that, there's still, like you said, a lot of folks in the healthcare community not fully accepting or recognizing these conditions and what that's like for patients. And I just wonder, you sort of refer to lifestyle medicine as common sense medicine, and I really like that sort of term, because that to me tells me that not that the journey's easy, but it sort of tells me that these are things that I can work into my everyday life. And I think that in itself doesn't seem so challenging for patients, or for anyone really, right? If I know that I don't necessarily have to go anywhere or do anything, I'm just taking my routine and sort of modifying it, um, that I can actually get better. So I was just wondering, how do patients receive this sort of information with lifestyle medicine? Do they feel sort of like, oh my goodness, I just can't, or does it feel a little bit more doable for patients? I guess.
Hmm. Honestly, I think it's a bit mixed. I think
Yeah.
some people see it as empowerment, right?
Yes.
That they have been, they feel like they've been suffering with symptoms that they have felt they don't have any control over. And when you teach them that there are things that you can do to help get control of those symptoms, for a lot of people, that feels empowering, right? That they can actually get control over these things that have, changed their life.
So really giving that control and that empowerment back to patients to have that sort of, to be able to manage their own health is what it sounds like as well, which is like
Mhm.
truly important when you're going through something and your body's essentially working against you. How do you gain that control back?
Right. And I think there is a lot of education around understanding how we can take more control over the symptoms that we have, like with within lifestyle medicine, even sort of with it external to it, right? Understanding the role of the nervous system and
Mm.
how that plays into the symptoms of pain and fatigue and really starting to understand how chronic pain works within the body is empowering for people, right? Once you understand it, you can take steps to help retrain the nervous system, to retrain, um, not retrain, that's the wrong word, but get into different routines, different patterns, different lifestyle modifications that can
Right.
help get your body back on your side when it feels like maybe it's not been on your side and against you.
Yeah, very, very, very interesting branch of medicine that we don't hear much of. And so far, you're the only person I know, doctor I know, practicing lifestyle medicine. I don't know anyone else.
There are people in Ontario practicing lifestyle medicine. Um, there are they're just spread out all
They're
over the
spread out.
place.
Yeah,
Yeah, but there are people in Ontario. There's actually a very large community of people in British Columbia
interesting.
practicing lifestyle medicine and sort of a big clinic. Yeah, so it's growing. It's growing for sure.
That's good to know. Okay, well, thank you so much for sharing your journey and kind of giving us a little glimpse into what lifestyle medicine is. And I guess the hope from here is that perhaps we can meet again and you can talk to us a little bit more about different things within lifestyle medicine and hopefully some good tips for patients to maybe practice while they're, on this journey of recovery.
For sure. Sounds
All right.
great.
Thank you so much. And we'll talk again soon.
Thanks so much, Michelle.
Bye bye.